Hello, my name is Professor Brian Dolan. I'm the originator of the End PJ Paralysis and Last 1,000 Days campaigns. And I just want to talk to you about deconditioning and the consequences of deconditioning, not just for people in hospital settings, but also those in home settings, particularly at a time when around half of the global population right now is in some form of lockdown. And what is brewing is a major public health challenge that we're currently facing. And when you unpick it, there's deconditioning, which is both physical, social, psychological, loss of tone, if you want to put it in those terms. It is significant and it is real. So, how do we encourage people to have structure, to get up, get dressed, and get moving every single day, even within the confines of their own environments? Because one of the consequences of staying in bed all day or staying immobile all day is it simply increases the risk of disability. And people, particularly older people with frailty, they have a 70% increased risk of dying earlier. They have a 600% risk of having a prolonged length of stay in hospitals. Muscle loss can be rapid, and it can have real consequence. And if you're in a hospital setting, for example, you spend 6 hours lying on a hospital trolley, that can lead to a loss of 1% of aerobic capacity, and that essentially is the ability to pick up a cup of tea. So mobilizing wherever you are is really important. Doing resistant weights, standing at the sink, standing on one foot, using a finger even just to stay stable, and that helps build core strength and core muscle tone. Every time somebody stands up from the chair in the sitting room or at the dining table, rather than using the arms of the chair to stand up, using one's own muscle mass to maintain quads muscle mass. And ideally, actually, every single meal, standing up, sitting down 10 times every time, that will maintain muscle mass. And quads power is the important one in the thighs, because maintaining quads mass reduces the risk of falling quite significantly. Even as in ordinary circumstances, about a third of people over the age of 70 have have an average of 3 times falls every single year. So we need to find ways to reduce that. And it's doing things like, using the milk to do weights, finding out ordinary household goods that are there, lifting up the chair, maintaining stability, keeping an extra eye on mats and things like that so that it doesn't constitute a risk. Checking in on people, because that's really important. Loneliness is associated with up to 27% increased risk of early mortality based on the work by Lundstad and her team back in 2014. And that is a higher risk than the consequences of smoking or obesity or even diabetes. It's a higher rate of early mortality. So checking in on older people, encouraging, and older, what does older mean? Older is as much a mental state as it is a chronological one. And there will be some people who are much more frail and vulnerable in their 40s and 50s, and there are people who are in their 70s and beyond. But the key is maintaining mobility. It is about maintaining movement. It is about maintaining muscle mass, and it's also about social connection. Those elements together will ensure people come through this safer, in a better place, into a world which is still there for them and values them greatly, very much.